to make a difference in your community and join the fight against this global pandemic. Loretto Hospital, in partnership with Affinity Health, are seeking healthy volunteers to find a potential COVID-19 vaccine. Interested participants can call 877-L-TRIALS or visit chicagocovidvaccine.com to learn more.
Against the Grain, you're on with Raza Siddiqui and my man Tio Hardiman. We are on with two special guests. But it's an exciting time, isn't it, Tio? I mean, I woke up this morning to some very positive news. As of Friday, we heard that we have rounded a corner when it comes to this pandemic, right? Vaccines are coming out. We are in a situation now where we're seeing light at the end of the tunnel. We're not in a situation where we're like, how long is this bleakness gonna last? We're actually seeing that humanity, human ingenuity has created something that's gonna help us. Tio, what did you think when you woke up and you heard that news?
Well, I feel pretty good actually, Raza, because now there's a vaccine, so people can because we've had to adjust to a new norm with the pandemic being around.
Yeah.
And so now people can go back to the actual normal, in my mind, we can go back to just going out, being around people, but we have to be cautious at the same time, because what I'm hearing, that's why I'm glad we have the show today. We have professionals here with us, Mr. George Miller, president of CEO of Loretto Hospital, and we have Dr. Ali, president of Affinity Healthcare System. So the main thing is we have a lot of questions that need to be answered. So because people just don't know.
And as always, we're going to invite our listeners to call in and ask these questions, 773-763-9278. I'm going to start by saying this. So I woke up this morning and you're going to see the same national news coverage across the country. You have UPS, you have FedEx workers, you have these essential workers who are on the ground, keeping the sense of normalcy, keeping society working, who are out there proudly distributing these vaccines, coming out of Michigan this morning, coming out of Wisconsin this morning. They're going to make their way all across the country. I was reading the New York Times this morning. I love this. I read this one thing that said Mississippi's top 2 health officials are planning to roll up their sleeves and get this vaccine. Headline being, we trust it. Not everyone does. There's a lot of questions. There's an anti-vaxxer movement. There's a lot of stuff. In this country, we are so fortunate to have liberties. Sometimes those liberties can also serve in the antithesis of public health, I believe.
Well, that's the reason why everybody needs to call Against the Grain with Tio Hardiman and Raza Siddiqui, because we're going against the grain today. But we also plan to kind of clear up any misperceptions about the COVID vaccine, because for example, I have a lot of people calling me saying they're not going to take the vaccine, number one. Some people are saying you need 2 doses. Why do you need 2 doses of the vaccine for it to be effective? These are just questions we need to get answered. And then number 3, people are saying mainly, what about side effects of the vaccine? Now, President Obama, he mentioned he would take the vaccine along with former President Bush, and I don't know if Clinton was a part of that. They said they would take the and Clinton.
Clinton was part of that too, Tio. And I couldn't help but wonder. I saw the picture of the 3 of them. I was like, why didn't they include Carter in this? Because he's actually of that age group where you think he should be first in line. But again, I'm not getting into politics here. I'm just talking you know what? There's some questions that need to be answered. Also, questions that I think needs to be answered are some of the disparities in the health infrastructure, and I think that's really where I want to bring in. Tio, like you said, we have 2 guests today. We have Ali Ahmed with Allied Health. He runs clinical trials, so he's really at the forefront of making sure that safety, efficacy is put into these vaccines we're doing. And we're very fortunate to have with us Dr. George Miller. He's not that kind of doctor, because I did ask him to look at something and it was an awkward moment for both of us. But George Miller, who is the president and CEO of Loretto Hospital, is with us today. George, thank you for being with us on Against the Grain.
Yeah, my pleasure. Thank you both for inviting both Dr. Ali and I to be here this wonderful Sunday afternoon.
We would like to start off without further ado about what it is that your hospital is doing. And one of the things that really struck me is Loretto Hospital, which is a community hospital, is at the forefront of these clinical trials. You guys are running this. You're not a teaching hospital. You're not an academic hospital, but you are servicing a community need. Kind of tell us about that. Tell us what led you to decide that this is something you need to pioneer, and in time for one of the largest health crises that we've had in recent memory.
Yes, I came to Chicago 3 years ago from Austin, Texas, to take the job at the Loretto Hospital, who's been in the community for about 90 years. And I'm proud to say I was the first African-American CEO in the history of the hospital there. And I started reading data on Austin and the community. One of the important things that really struck a nerve with me is that if you live in downtown Chicago, life expectancy there is 88.2 years of life. But if you come just 9 miles on the Eisenhower to exit 23B, the community of Austin, it drops down to 68.2 years of life. You lose 20 years of life in a 20-minute drive. So the reason for that is because of inequity and disparities in healthcare. Before COVID even showed up, it was that stark of a difference in the city of Chicago, with more hospital beds than any other city in the world. Chicago has, and that amount of disparities existed. That really bothered me. And part of our message is we looked at the strategy for the Loretto Hospital is one, while we have these incredible statistics that are horrific, we said we got to be part of the solution. So we met with Dr. Ahmed and decided we would do 4 things. We would do clinical trials in his firm. We partnered with him to do clinical trials. We would do medical research. We would do medical education, and we would have also residency here. We want to become a teaching hospital. We are now FDA approved to do double-blind clinical trials approved by FDA, and that's significant. We're the only safety net hospital that I'm aware of, certainly in Chicago, and I believe in all of Illinois, that is approved by FDA to do double-blind studies for medical research and a whole host of issues. Dr. Ali will talk about that just in a few minutes. But we are now approved by 3 different companies to do clinical trials for COVID. We can do that right there. Across the United States, African Americans make up about 13% of the U.S. population, but only 3% of clinical trials. And we think that's wrong. We should be involved in clinical trials. We should be able to lead that effort and having that done. Again, scientifically, based on science, not innuendos, not rumors, not background information, but do it according to the FDA standards. And that's what we do at the Loretto Hospital, thanks to Dr. Ali and Affinity Health.
You have a population that comprises 13%. 2% have access to these clinical trials.
Historically.
Or is it access or is it the choosing? And again, how do you create that infrastructure? How do you create that education that this is an opportunity available for you?
Yeah.
And it's something that you should look into. Tio, you and I were talking about this. Sometimes there's a trust perception of, you know, I'm helping out. What am I getting? How do you I'm not going to say combat. How do you educate?
And that's the key word. You have to educate. You have to deal with the facts. Historically in America, and I please forgive me for saying so, but the reason the disparities and equities exist is because of racism. And there's no other explanation for that. We make up 13% of the population, and the statistics for COVID deaths in Chicago are abysmal. The same thing for the virus. We have twice as many African Americans in Chicago, make up 30% of the population, but yet account for 72% of those who get COVID and 62% of deaths. Double. Wow.
Now that's really something. That's really
if you look at social determinants of health, those are some of the reasons. Housing, discrimination, you know, and again, I believe in speaking truth to power. Chicago is one of the most segregated cities in America, and because of that, essential workers they live 4.2 persons per room in Chicago versus in other communities it's only 1.2.
Yeah, and then also when you talked about the numbers with the disparities with the only 3% of the African American population were involved in any type of trials, you know. So this is another thing in Chicago, the epidemic of gun violence, for example. 80% of gun violence victims are African American people in Chicago. And then right now, when you look at it, you have 12,000 carjackings in Chicago this year. The year's not even over yet. That's almost 1,000 carjackings every month. All right, 3,700 shootings in Chicago so far this year, and over 730 people have been shot and killed in Chicago. It makes no sense. So the African American community continues to be, I would use the word victimized by whatever the forces may be, racism, discrimination, and some of the gun violence. So it's a whole lot of work that has to be done. So I appreciate you putting them numbers out there because people need to know this. They need this information.
Yes. Well, thank you. But the other side of that, we have to find solutions. So we've decided at Loretto Hospital, we will be a solution.
Good.
Again, with medical research and clinical trials that Dr. Ali, who's our partner, does an excellent job, and he can talk about the specifics.
Yeah. And we got quite a few callers waiting for us too.
Sure.
All right.
We do have quite a few callers. We want to invite anyone else who's listening, who's part of this conversation as we enter a very exciting time, but it's got to be a very equitable time too.
Yes.
Like you said, the proportions of the people in certain communities who don't have access to this needs to be addressed, and we want to have this and talk about this conversation. You can join us at 773-763-9278. Tio, like you said, we have quite a few callers. Who you want to kick it off with?
We'll kick it off right before we get you, if you don't mind, Dr. Ali. Let's kick it off with the I think up top, Lewis. Lewis has been hanging in there a little longer than everybody else. We get Lewis, then Ron and David, but we'll go to Dr. Ali after this. Lewis, you're on the air. Lewis?
Hi, my name is, can you hear me?
Yeah, we can hear you.
Oh, okay. So I'm here to mainly talk about the Community Builders Program. And I wanted to just share some information regarding that. I know firsthand how incredible this program is, and I faced a lot of roadblocks in my career journey. And a lot of people in the minority community have encountered the same roadblocks. Now, Community Builders is offered by ABC, which is Associated Builders and Contractors. Program provided an open lane for me, and I need to apply myself and work hard because Community Builders, as I assumed and found out on my way, was a rewarding career that provided financial stability for me and my family.
Yeah, Lewis, I appreciate that because what happened is I know you talked to Jerry Thomas, my publicist, but I want to get you on next week for sure to talk about your program in more full detail because I was waiting to hear back from you so we can address that issue.
Tio, let's go to our next caller real quick. We have a caller from California, Ron.
Yeah.
Ron, you're on with Dr. George Miller, Aliema, and of course, Tio Hardiman and Raza Siddiqui. What's your question?
All right. Thank you. I work with students out here in California and across the country on the knowwhat'sinit.org, and we focused on an issue which they brought up a question about this vaccine. And, there is some skepticism, but yet if we had government reports, a suggestion they came up with every week or every 2 weeks, that actually, because of the technology tracking all the viruses, the vaccine given, that vaccine being recorded, we could tell how many side effects were occurring. If we had less side effects over time, we'd have more people to take on the vaccine than otherwise will now.
So how are things going in California with the virus? Do you know some of the recent numbers, current numbers in California, Ron?
Well, we're on kind of partly a mandatory shutdown, stay at home. And we got a lot of problems out there because we've got increases.
Yes.
Most people get tested, but my problem with testing, because with a student project we worked on with AIDS, when you tested for an antibody and for HIV, you knew whether or not you had it. If you didn't have it, you had enough sense not to get it because you could prevent it. You can't prevent this disease. You go out and get a test today, tomorrow, or in another hour, you could be infected. What we need is this vaccine. But we need people to understand that it's safe. And over time, if we have mandatory reporting on every test that's out there, which we have the technology for, people can be told about it.
Okay, good information.
Continuance, or less side effects and less risky. And the community is skeptical.
George, that's a great point that there is a lot of skepticism, right? There's anti-vaxxer movements out there, anti-vaxxers. They just don't trust vaccines. We're trying to talk about the community and how to get the word out in the South Side communities, the West Side communities. You were talking about Austin. We're talking about Austin as well. We need to talk about how we can overcome these challenges and get the word out there and educate people that, hey, this vaccine, we might not know everything about it, but we trust it. These officials, these health officials in Mississippi taking the shots, they trust it. These former presidents, which that included Carter, are testing this. What is it about it? What can you offer people in terms of telling them that this is something that you need to sell, that you need to take for public health?
Well, thank you for that question. It is an important question. Historically, we've had some problems with dealing with vaccinations, but I am very clear that I'm going to take it when it is available for me. Certainly, first will be those immediate caregivers who give it, will have the option of taking it. But the most important point I'd like to make to everybody who's listening, the vaccination is an alternative to what we currently have now. What we have now is almost 300,000 Americans who are dead. We have over 16 million that have the disease. And the only way that the disease spread is from humans to human. The only way to combat that, will be if we all develop herd immunity. We take the vaccination and keep the spread of this dreaded virus from continuing. Until that time, everybody needs to wear a mask, practice social distancing, and wash their hands. Had we done that back in March of this year, we would have saved 100,000 lives. Wow. So my issue with those who don't look at the science, trust people who are doing it scientifically and doing it ethically and correctly, look at the science, look at the facts. That's education. The other thing that I'll point out to the audience, it was and Dr. Fauci said this the other day, it was an African-American woman who developed the COVID vaccination. It was Kismika S. Corbett, a PhD for the American Society of Microbiology. She is one of the leading proponents of an African-American woman in America.
Okay, good. So with that being said, we want to bring Dr. Ali in the mix here, in other words, to talk about Affinity and what you plan to do and how you partner with Loretto Hospital, which we really appreciate you partnering with one of our hospitals right in the heart of the Austin community.
No, thank you. And it's been an honor to work at Loretto Hospital and work on clinical trials, which offer many benefits to those who choose to participate. Clinical trials have been a standard in healthcare for many, many years. And the importance of running a clinical trial is to establish that any drug or any vaccine is safe, first and foremost safe, and effective. Right. And I can assure the audience and anyone who has the question that no shortcuts were taken in the development of all vaccines that are being developed, Pfizer, Moderna, and many others that are being developed. That is a standard that the FDA would never allow. And our role as Affinity Health is to provide the expertise of running these clinical trials to communities where Loretto has been so proactive in establishing this partnership that allows us to reach the community in the western side of Chicago.
We're very glad that you were able to tell us that. We got to hit this commercial real quick, but when we come back, we do want to talk about the fact that we've heard about Pfizer, first to market, right? There's other treatments out there. 40 somewhat vaccines from what I'm hearing. And again, part of the reason is we need to have different solutions. There's some, limitations sometimes first to market. You're dealing with temperatures 94 degrees Fahrenheit, negative 94 degrees Fahrenheit that these medicines have to be kept at. There's going to be other alternatives coming out there. And I believe, Ali, that is where your company comes in. You're testing other vaccines.
Yes.
Just because it's first to market doesn't mean there's not other stuff coming out that we're going to see is safe and efficacious. And we're going to be talking about this right after this commercial break.
Good.
The minority groups in America are severely affected by COVID-19 due to healthcare and economic inequities. Chicago, now it's your time to make a difference in your community and join the fight against this global pandemic. Loretto Hospital, in partnership with Affinity Health, are seeking healthy volunteers to find a potential COVID-19 vaccine. Interested participants can call 877-L-TRIALS or visit chicagocovidvaccine.com to learn more.
Megan Financial is an independent retirement and financial services firm dedicated to the working men and women of organized labor. Megan provides straightforward, custom-fit financial advice and specializes in defined benefit and defined contribution pension plans, as well as participant and retiree health and welfare benefits. Megan Financial has the knowledge and experience to navigate the union member through all phases of life. Call 708-444-1090.
Securities and advisory services offered through Cetera Advisors LLC, member FINRA, SIPC, a broker-dealer and registered investment advisor. Cetera is under separate ownership from any other named entity. Office location at 5321 South 94th Avenue, Orland Park, Illinois, 60462.
Ever wonder about the story behind the story? Who are the people you watch delivering the news, filming the scenes, and putting pen to paper to tell the story you read in your morning paper? Tune in to Media Essential Workers on Facebook and YouTube to find out. With constant changes in the Chicago media landscape, one reliable source keeps track of the people bringing you the stories. Media Essential Workers, the premier live stream telling the story of the storytellers. Sunday nights at 7. Like, subscribe, and follow Media Essential Workers to find out about special shows during the week. Hosted by Raza Siddiqui, Media Essential Workers gets the story of the storytellers.
You're joining us on Against the Grain, Tio Hardiman, Raza Siddiqui. As we round this corner into a very light at the end of the tunnel scenario in our country, and especially here in Chicago, we're inviting into the conversation George Miller, Dr. George Miller, and Dr. Ali Ahmed. George Miller is the president CEO of Loretto Hospital, and Ali Ahmed is doing clinical trials at this hospital. Pioneer in terms of a hospital, in terms of doing clinical research at a non-academic institution. George, I'm going to start with you. I'm going to talk about the fact that we're in the middle of a pandemic. Every hospital bed, every probably square foot of that hospital needs to be utilized. You guys have been forthcoming and forward-thinking enough to establish clinical trials there because it's a need that needs to be met. We're going to start with that. Then, Ali, we're going to go into you to talk about some of the work that you guys are going to be doing. George, let's start with you. How do you manage clinical trials to make sure the future of this country and the Austin neighborhood and all the neighborhoods is taken care of amongst a pandemic?
Well, first of all, Dr. Ahmed and I sat down 12 days after I started at Loretto Hospital, and we did a strategic plan. And part of that strategic plan was to do medical research, as I indicated, to have medical students, to do clinical trials, and to have medical residents. And we mapped it out on a napkin, quite frankly, of what we're going to do. Because to move to the next level, we had to be able to do training, education, and clinical trials. So we met Dr. Ali Ahmed and his company, and he has taken it from there. And we're FDA approved. We're very excited to partner with them to have that capability and to increase some of the disparities of healthcare. And part of the reason is you got to have an institution people can trust. We can talk about how we can improve lives, and even in our COVID vaccination trials, we will be. The patients who participate in will receive a small stipend, will provide their health care for free, and it's for 2 years. So everything related to the clinical trials will be done under strict FDA guidelines and requirements, and we have to document all of that information. His staff is absolutely amazing in making sure we do everything first class. So even though we're a safety net hospital on the west side of Chicago, we still can be excellent. And so our whole mission is to be excellent at everything we do. And so that's what we're providing for our community, something they did not have before.
Well, George, I want to ask you about that too. So you're talking about you have limited health insurance. You're talking about maybe you don't have health insurance. If you participate in this study, you are going to be monitored as though you have the best health insurance. Is that?
Absolutely. Absolutely. That's part of clinical trials, that person, we don't have anything outside influence, and it's not an issue like we currently have with those who don't have insurance. They can't get healthcare like those who do have insurance.
Exactly.
And so the clinical trials affords them to get the best of healthcare, to everything paid for as part of the clinical trials. And that's what Pfizer has done in the past. And all of the other companies, they do this. And we want to provide that opportunity for our community to take advantage of the expertise, the clinical trials. And that's how everything in America, as far as new modalities for healthcare has been done through clinical trials.
So Raza, what I want to do now, let's take Brother David in from San Francisco. He's been waiting for a while. Then we get to Dr. Ali. Maybe David has a question. He talks about COVID dieting. He's David, you on the air.
Thanks. I was kind of shocked when I heard, as you were opening the show, you were talking about one neighborhood in Chicago had a lifespan of 88 years, and the other one just south of town was 68 years. So I was wondering if I've been hearing, various things. Vegetarian friends are saying that if you're eating meat, you're going to be more susceptible to COVID. That whether or not there's certain types of meat that you might eat that are good or bad. I'm wondering if they have any information on that. And then the other thing is whether or not they, the other thing is whether or not they have any information on whether or not COVID is a pollution, is a disease that originated in the pollution of, say, Wuhan, China.
Okay.
And that if it's such a unique, brand new disease, then that might explain, why, all of the ancient medical writings have never described a disease like this.
So this we're going to do, David. Raza, we're going to allow Dr. Ali to answer that question. So Dr. Ali, just to bring it more up to speed, if you eat a lot of meat, would that help create a situation where you might be more susceptible to catching COVID or something like that?
Tio, I'm going to add a little bit of another layer there too, because I want to talk about the dieting, but I also want to talk about what we've heard about core, other conditions. Like people with COVID are ignoring other things, right? I mean, they might be focusing on diet, but are they getting their blood sugars tested? Are they keeping their stress down? I mean, we're in a situation where I'm living with my wife and my 3 kids. They're all at home. My blood pressure has never been higher. I should probably get that monitored. I'm scared to go to the doctor. Ali, what do you say?
Well, a lot of points there, but I think in summary, it's important to understand that everyone is susceptible to this virus. Yes, your diet and your lifestyle, if it isn't healthy and it reduces or it increases your susceptibility to other diseases because your immune system drops, you are a prime candidate to, again, get the infection, because your body and your ability to, fight off diseases in general is compromised. For the virus itself, we have to look at this as everyone is susceptible. So I'm not going to say that, eating meat or other things are going to have a significant effect as much as, those types of situations. In terms of, as Raza, you're bringing up, this virus and this situation is a global pandemic, and no one is immune to it. So it's critically important for when we look at the treatment options from the hospital's perspective, from physicians, the ability for us to tackle this has to be multifaceted. And the hospital has been very successful in addressing this from different angles.
Okay, good information. That's good information. Appreciate that.
Well, and another thing I think that we should touch upon is, again, we're in a situation now where on the delivery trucks today, you see a FedEx truck, you see a UPS truck, vaccines are being delivered with the whole condition of being kept cool, ready for major distribution. How did they get on that truck? What is it that you guys are doing? There has been skepticism with the current administration, some of the views on sciences on how these things are tested. Ali, you could tell us how they're tested, right? I mean, this is what you do. This is something you've done prior to this administration, irrespective of what administration's out there.
Yeah.
You have a science background. What is it that you do?
Well, I really do want to, again, give people assurances that it does not matter who's in the White House. It does not matter who is running the government from the perspective of the politics of it. Science and what the FDA has set up in terms of quality standards, in terms of showing a drug or a vaccine is effective while maintaining every subject that's on their safety, and then the ultimate safety when the drug is administered after the clinical trials, that is never compromised. And so it's so important to keep emphasizing those points, because we are dealing with a lot of people, saying a lot of things and a lot of pressure. People perceive that there was a lot of pressure to get these vaccines through the system and approved. And while technology and the amount of funds spent to ensure that the top technological advances were applied in the development of these vaccines and making sure that the funding was there, safety was not compromised, and the ability to get the data to show that the vaccines are effective was never compromised.
Good information, yes.
And tell us, what is that? What do you guys do to make sure that product is safe? is I always mess up this word, efficacy, right? Was that right? That was kind of close, right?
Sure, very close.
What do you guys do? What goes into that? These take years, right? These usually take multiple years. There's been expedited approval, again, because there's a public health crisis. How do you guys deal with it?
Well, and again, the reason they take years down compared to what happened with the COVID vaccines is that in this situation, the funding was available to do multiple studies at one time. The funding was there to really develop studies that answered those questions immediately. And the funding was there to develop the vaccines in record time. So again, it's very important for us to all understand that safety and the data were never compromised. I hope that answered your question.
That's important. So we have a few more callers on. Let's bring Mr. Eric on. Then we'll bring Paul on after Eric. Eric's been holding on for a while. Eric, how you doing? What's your question here today?
Good afternoon, my dear brother. Good afternoon, Siddiqui and doctors. It's a great show, gentlemen. What I would like to address is the real skepticism of the Black community against this vaccine. We don't have to go so far, and there's an inherent mistrust of not only the federal government, but the medical community. You know, we don't have to go so far back and say the Tuskegee experiments or the Indians having smallpox or things like this. Even if you just look at prior to the vaccine, only 58% of African Americans would have even considered taking. And now that the vaccine is here, that number is down to 26. What we do know is that early on, there was no transparency from the CDC. There was no transparency from the Illinois Public Health Department for those of us who are on the front lines trying to seek answer when this virus was spreading like wildfire through the Black community. And now we're being told that the quality standard is good. We don't know that. Anytime anything is rushed, there are always casualties. Those of us, although we're not that old, we remember when they came out, when they rushed the polio vaccine and parents rushed their children to get the polio vaccine, over 250,000 kids died from a vaccine that was not perfected. So it's almost insults our intelligence to tell us that anything, the quality standard of something that is rushed is not compromised. We understand that there are advancements in medicine, but how can we trust the government? The government did nothing for the epidemic of gun violence. They did nothing about Black folks living in poverty and dying. So all of this is connected. The government and the medical community, they cannot be selective. Because in the very beginning, what they did is that they victim blamed us, Tio and Siddiqui. Black folks wasn't washing their hands. Black folks wasn't social distancing. And so...
Well, let's do this, Eric. I got Dr.
The whole community side-eye.
Yeah. Dr. Ali wants to respond to you there. Hang in there, Eric. Listen to Dr. Ali. Then we're going to take Paul in a little while. Okay. Here you go.
So, Eric, I absolutely want to say how important it is for those concerns that you have communicated are addressed. And, honestly, it's going to be up to everyone to decide on your own, whether or not you feel that taking the vaccines that are coming out are safe. All I can tell you is from my vantage point of being very involved in the system and the process and understanding that the FDA and people hear a lot of stuff that comes from the government or the press regarding the pressure that was put on. I mean, that's just not true. I mean, the fact is the FDA operates independent of any political pressure. And yes, you're right. Over time, there have been issues, and those issues like the Tuskegee trials and other things. But even more recently, these two clinical trials, the Pfizer clinical trial and Moderna, were initially enrolling very few of minority populations. They actually had to delay the Moderna trial to address that. And for the Pfizer trial, they had to add more participants than was initially requested by the FDA to address that. So this is a real problem. And the fact is that, we have to basically look at the fact that in the many years, the FDA has become very conservative. What does that mean? They require more data, more oversight to ensure that patients are safe and that the drug is effective before they will ever approve anything. And that the best I can tell you is nothing was compromised for these clinical trials. And yes, it's going to take time for us to see that, and many people may choose to wait. I would encourage, and I would hope others who have said that they are planning on taking the vaccine will help the community and the population to understand that it is safe and that nothing was compromised.
Sounds good. So yeah, Brother Eric, so hopefully that answered your question. I don't know if Mr. George Miller would like to have a few comments about that as well before we go to Paul.
Yeah, just a few comments, because Dr. Ali is exactly correct. And we certainly understand and appreciate your comments about what has happened in history over the years with situations like the Tuskegee and others. However, one of the reasons why I'm at the Loretto Hospital and want to make sure that we watch out for our community. The statistics I gave earlier are real. And I've said very clearly that Chicago is one of the racist cities in the world. And part of the reason of the high numbers of the COVID is because of some of the social determinants of health that happen, the housing, the redlining, the food insecurity, all of those mix up. But we have a solution to the problem. And as Dr. Ali said, it has been, and things certainly have changed over the years. We have advancements. And in fact, the reason we were able to do the vaccination much quicker than normally is because we've been able to deconstruct the RNA of the virus. Okay. And that is one of the reasons why it moves so fast. We will not have pandemics taking a long time as we've had in the past because of advancement in technology in medicine. But what I'm here to say is, as a gatekeeper for some of the issues you just raised, that's one of the things we give that promise to you. That's why we wanted at the Loretto Hospital, taking care of African-American people, run by an African-American CEO, that we want to make sure that you understand that we're doing the best thing for our community. We have to have our community to survive. And that's why we're involved in this and having medical education and a whole host of things we need to do to bring parity. Now, I will say this, one of my colleagues, Mr. Jose Sanchez, and I wrote a letter to the Illinois Hospital Association. We wrote a letter and saying, because of COVID, the disparities in the Black and brown communities are atrocious, and we've got to do something about it. For the first time in the history of the Illinois Hospital Association, they appointed a committee to deal with this very, very issue. You have to speak truth to power. You have to stand up for the right things, and that's what we're doing here.
Right on.
Thank you.
Okay,
so we got to hit this commercial break real quick, but when we do come back, we do want to address speaking truth to power. I'm going to give you the opportunity to talk about state and federal funding is going to be absolutely paramount when it comes to the distribution of this, correct? And we've spent a lot of time talking about the CDC and the testing. We want to talk about how you guys are going to get the infrastructure financially from these governments to ensure that you meet the goals that you want to in terms of getting the healthcare out there. When we come back from this commercial break, you're welcome to join the conversation. Reach out to us at 773-763-9278. Against the Grain, Tio Hardiman, Raza Siddiqui will be back after this.
Are you interested in being one of the first participants in a COVID-19 vaccine clinical trial in Chicago? Affinity Health is currently seeking healthy volunteers who may be eligible for a COVID-19 investigational vaccine study. This will take place at the Loretto Hospital in Chicago, Illinois. We are looking for people who work as teachers, factory workers, retail workers, or anyone exposed to many people during their workday. Visit chicagocovidvaccine.com or call 877-L-TRIALS to learn more. That's 877-587-4257.
Megan Financial is an independent retirement and financial services firm dedicated to the working men and women of organized labor. Megan provides straightforward, custom-fit financial advice and specializes in defined benefit and defined contribution pension plans, as well as participant and retiree health and welfare benefits. Megan Financial has the knowledge and experience to navigate the union member through all phases of life. Call 708-444-1090.
Securities and advisory services offered through Cetera Advisors LLC, member FINRA, SIPC, a broker-dealer and registered investment advisor. Cetera is under separate ownership from any other named entity. Office location at 5321 South 94th Avenue, Orland Park, Illinois, 60462.
Ever wonder about the story behind the story? Who are the people you watch delivering the news, filming the scenes, and putting pen to paper to tell the story you read in your morning paper? Tune in to Media Essential Workers on Facebook and YouTube to find out. With constant changes in the Chicago media landscape, one reliable source keeps track of the people bringing you the stories. Media Essential Workers, the premier live stream telling the story of the storytellers. Sunday nights at 7. Like, subscribe, and follow Media Essential Workers to find out about special shows during the week. Hosted by Raza Siddiqui, Media Essential Workers gets the story of the storytellers.
You're on Against the Grain, Raza Siddiqui, Tio Hardiman. We're joined by two very special guests today, Mr. Ali Ahmed and Mr. George Miller. George Miller is the CEO, president of Loretto Hospital. Ali Ahmed is with Allied Health and doing clinical trials for the coronavirus and helping to get the vaccinations out there. We've been talking about kind of the sometimes what the funding can do to benefit, but also sometimes obstructions. We want to make sure that local, state, federal government, are you getting the resources you need to help with the distribution, George?
In a word, we're very blessed that we've received some funding, but this has been something we've never seen before. We've had to decrease, obviously, some of the operations, particularly elective surgeries. That's now back up. We do work very closely with the city, especially the Chicago Department of Public Health. We work with the Illinois Department of Public Health, and we also work with HHS, other federal government. There's never enough money to do what we need to do, quite candidly. And so we one of the things I want to point out what we've done first, and then I'll talk about the resources. We still provide to this day free testing for COVID. In fact, we got a larger tent. We've done over 18,853 as of Friday of the citizens in the community, and anyone can come in and get testing for free because that's the information. You got to have testing, but we do need resources to continue to do that. So we're working. We have some great Congressman Danny Davis and Senator Duckworth and Senator Durbin worked very hard for us, and also got to give a great shout out to Majority Leader Kimberly Lightford, Representative LaShawn Ford, and Representative Camille Lilly, who worked very hard to get us additional funding as quickly as it can. But to answer your question, COVID hit us so very, very hard. We didn't have the resources. We had to buy extra PPE, and the price has gone up. Staffing is always a challenge, and we have to continue to provide care for the other patients who don't have COVID at the time. So there's never enough resources. We're always looking for more resources.
All right, good stuff. So we want to bring Paul on. He's been waiting for about 24 minutes here. So, Mr. Paul, you're on the air, and thank you for waiting to get on the air. So what's your question, Mr. Paul? Yes.
First of all, I'd like to say that in this state and in other parts of the state, the African community, specifically the low income, lives in a apartheid form of hospital. The healthcare system is an apartheid system to them. Second of all, I'd like to show you that here in Chicago, after the people who were tested, they were told to go back home to their loved ones with a highly contagious disease, and it spread it like wildfire. Now, that's like telling people who got smallpox to go back home to their family and wait till the smallpox leave. A lot of these people died and all that. So I'm very suspicious of this virus that no one seems to explain what elements we have in it. That's number one. Number two, I noticed how when the question was asked about the black community, how you quickly, both doctors quickly dismissed that black people was experimenting on. And we don't have to go back to way back when. We can go all the way up to the 80s and the 90s, where Black people were tested on by the health industry. So how is it that you're going to deal with? Because you're not going to just say that you're going to inoculate us. You're not going to just say you're going to give us a test for a virus, and you haven't given us no health care. Why the virus has been going on? And all of a sudden, now you want to save us? And then you have this mayor that dismantled 2,400 beds. So if we had a pandemic, now you reason with me, just as a person in society with common sense. We have a pandemic and your mayor is dismantling a 2,400 bed for people to be quarantined and away from their family so they wouldn't spread the family. And not just that. I don't hear any health experts stepping up and saying, well, now we're going to open up the schools and the children will go back to school. But you're sending the children back to these teachers. These teachers can have it. And then these teachers, not knowing, then these teachers can spread it to the parents. So this whole notion of Black people specifically is going to just go in there, volunteer, stand in line, and take shit. I believe you're going to have a violent revolt. Violent revolt if you try to force this down the Black community. I can't speak for the Latinos. And I think you should have some of them on here too, because they was experimenting. But I would like y'all to answer this question. Let me finish.
Yeah, go on, finish. We'll answer your question.
These doctors to answer this question and don't skirt the answer, because that's what you did a minute ago. It's serious for Black folks.
Okay, we're gonna let Brother George answer that question somewhat. But what I like about what you said, I believe you talking about how Mercy Hospital was closed down recently. Mercy Hospital on the South Side, so they had a lot of beds for this particular pandemic to service people. So, Dr. Ali, George, you want to take that on?
Yeah, I'll take on the question. I thought I did not skirt the issue. I respect your opinion. One of the things I said in the beginning is this is the reason that Loretto Hospital and I specifically wanted to do medical research so the community can trust us that the problems that has happened in the past will be now dealt with from a professional according to the standards. We won't do things against people, but to protect them and to give them hope. You get free health care by going through clinical trials. And we also said that, and no one's going to be required to take it. It's going to be a voluntary set. We're not making anybody take the test. We think it's advisable because today there is no solution to coronavirus. It exists and it is killing people, and it's killing African American and Hispanic at twice the rate of whites. So we're trying to find solutions to help solve a problem. And one of the major problems in America, and I said it earlier, we all don't wear masks. That is better than a vaccination until the vaccination can hit 100 million Americans. That's the only way. That's called herd immunity. Till we hit the number of 100 million Americans, this virus will still run rapid and it will spread as you described. But we're not requiring people to take the vaccination. It's available. We're not going to make you stand in line and take a shot if you don't want. We do have freedom. You have the choice. But what we are saying, if you look at the science, if you look at the data, if you look at the facts, this particular vaccination will help save lives. And that's what we're here for. All of us who go into healthcare are here to help people, to save their lives and to stamp out disease. That's what we're here for. That's what we dedicate our lives to. We are servant leaders. My mother was a nurse and taught me to be a servant leader, to help folks that are less fortunate than ourselves. That's why we exist on the west side of Chicago. To do that very thing.
And Dr. Ali wants to just add a few more comments.
Sure.
Yeah, I'd like to really add to that. And again, I think as George said, we feel it's critical to talk about this and to address those very real concerns and issues that people have. And really but the way I want to bring this up is to address how George has mentioned, we wanted to bring clinical trials to the hospital, and we've successfully done that. In the last 3 years, we have at Loretto Hospital run clinical trials for patients with heart disease, sickle cell disease, gastrointestinal issues, asthma. So all of these conditions, we brought medications to the community that we're in these same type of clinical trials, and the best advocates for what we are doing are the patients who benefited from these. And many of them have come to us and said, Thank you for giving us a treatment option that we may not have had. We couldn't afford to treat the conditions that we have tested. But the clinical trials that you ran gave us an opportunity to get free health care, gave us an opportunity to see a doctor, gave us an opportunity to look at and to address the conditions that we've had. So what we're trying to do is really establish the credibility in the community, and we hope that every one of you will give us a chance to continue to establish that we will never take advantage of anyone. There are rules and regulations to protect each and every one of you.
Appreciate it.
You know what? We're going to have to kind of wrap it up here. Our show's running out, which is unfortunate because our boards are lighting up here.
Yeah,
We've got a lot of people because
yeah.
there's a lot of people interested in this subject. I want to remind you that you guys can continue this conversation on our Facebook page, where we're always on. We're not restricted to time constraints. And that is Against the Grain with Tio Hardiman and Raza Siddiqui. As we log out, I just want to make sure to give Ali Ahmed at Affinity Healthcare and George Miller just a real quick opportunity. Give me 10 seconds about how people can contact you. Ali, let's start with you.
Well, go on our website, affinityhealthcorp.com, or the Loretto Hospital website. Just Google us, and you can get all the information on clinical trials and the healthcare opportunities that the hospital provides.
Got it.
George.
Yes, sir. At our website, too, at Loretto, www.lorettohospital.org, O-R-G, on our website as well. And we're there with Dr. Ali, and Affinity Health is on that website as well.
Fantastic. And you can always join.
I just want to quickly say, I want to thank everybody for, calling in today. It's been a blast. And then all the people that are called in, tuning in next week also for Against the Grain with Tio, Ms. Tio Hardiman, and my co-host, Mr. Raza Siddiqui, right here on 820 AM, WCPT Progressive Radio.
Sounds good. Watch us on Facebook too. Thanks, everyone.
Right. Good stuff. That was it.